Dr. Lee, let's talk teeth whitening or teeth bleaching. And there are really kind of like, I don't know how many different methods, but let's talk about the one you buy over the counter, a tray and kind of put it in and all kinds of things, strips. Then the ones which are, kind of a tray, a custom-made tray which a dentist administers, and then the one which has machines involved, like laser machines, and apparently goes very, very fast. Kind of like give us the picture, the pros and cons of all three of them, if you will, please.
Okay. Well, regarding the over-the-counter products, the only thing I've seen consistently between patients that really works are the crest white strips. The only problem with that is your teeth have to be fairly straight, because it is a thin film that goes around your teeth. If you have a lot of turns arounds and crowding, then it's not going to sit well, and you might get selective bleaching on just certain parts of your teeth. So, other than the crest white strips, I probably wouldn't say there's a lot of over-the-counter products that work well. And the other thing with the crest white strips, you tend to only get bleaching towards the front of the teeth. So we might see the patients and they'll have, white teeth near the front, but if they have a big smile, you're not going to see that the back teeth are really lightened too much. So there are a lot of limitations with those white strips. The bleaching trays that we fabricate, we make a custom molded tray that fits all your teeth, and the gel that we provide is a lot stronger than the ones they sell in the stores. So, it usually takes about a couple weeks or so, but you will see that your teeth are getting lighter. And, how much it's going to lighten, we can't really tell you, because the composition of your teeth and, how long the stains have been there really make a lot of difference. So we can't really predict how much whitening you'll get. When it comes to the laser bleaching, the zoom bleaching, the things you've heard of, it takes roughly about an hour or so. We put a gel on your teeth that's activated by light, and that causes oxidation of the pigments and allows your teeth to get bleached a lot faster. So if it's something where you need to get bleached and you can't wait 2-3 weeks or want to fiddle around with the trays, an office whitening with the light activated bleach would probably be your best solution.
So if, are you getting it more white with the bleach, with the machine than with, let's just say, the tray which you make?
No, the results are about the same. The only difference is the length of time. With the bleaching trays at home, you'll probably do it for an hour, 2 hours a day, or depending on the concentration, you might wear it all night. You have to do that a couple times a day. And if you don't really want to do that for about 2 weeks or so, then you'll probably do the in-office to get it done in an hour and move on. It's really more of a time thing.
Got it. And of course, again, different folks, different strokes. Me,
right.
I would go for the 1 hour simply because I'm, impatient, basically, type of things. Just like I would probably tell you to put 2 veneers on it rather than a braces to straighten out my teeth if I would have to, that type of stuff. But that's, again, not everybody like that. Now, what about if you get it bleached? And most of the time, most of us have, we need tooth bleaching simply because of our lifestyle, be it drinking coffee, red wine, smoking, things like that. Most likely, the people who do bleaching will not stop that lifestyle, because this is, very hard to do. So, I don't know, a year, 2, 3 years later, they get again brown teeth. Can they bleach again? Or is that something where the teeth and the whole structure can only take so much?
If you're going to do the in-office whitening, depending on how hard your teeth seem to be, we might do that once or twice a year. I don't really like to do it too often on a patient, because I don't want to damage their enamel. Now, some of our patients, what we can do with them is we might do the in-office bleaching the first time, and then we'll have them do a monthly regimen of a custom molded tray where they might do it an hour a month just to kind of maintain their results.
Well, that makes sense.
We have that. Yeah, we have that option. The way bleaching works, the tooth gets temporarily demineralized. So little pores get opened up into your tooth. The bleaching material gets inside there, and it starts to oxidize the pigments. So the longer the bleach stays on there, the deeper it goes in. So of course, you can end up with more sensitivity on your teeth, more kind of demineralization of your teeth. But within a couple of days or so, the minerals in the saliva, they start to plug up those holes again. So, you're okay after that, But if you're constantly bleaching, you can cause irreversible damage to your enamel, and we definitely want to avoid that.
Okay. Well, that's definitely interesting. Get a shutdown, go to a dental office, come out an hour later, have white teeth, and then more or less, depends on your lifestyle, once or every month or something like that, go and wear a tray for a few hours while watching TV or whatever it might be. That sounds reasonable to me. Now, I have heard that some people who go to the store and buy their bleaching kits, one of the reasons their bleaching kits are not working so well is their concentration isn't so strong, and it is not so strong because the tray is not custom made, so the glue or whatever that thing is always comes out a little bit, and if it would be very strong, it would damage your mouth. Is that correct?
Yeah, a lot of those products out there, they're starting to make it so you can kind of boil your own tray. So it is a fairly custom molded tray.
Ooh.
And that's not so bad. The problem is the materials they sell, they can't sell them in high concentrations just because, if you give that to everybody, then, there's a lot of patients that might have some bad reactions to it. So the stronger concentrations have to be provided by your dental professional. What's available to the public in the stores is something that's fairly safe to use by anyone. But,
All right. Now, one other thing I have heard, that some people go to the store and do whatever bleaching, the crest white strip or whatever, and and if they're willing to wear it a lot longer, again, it's not necessarily such a bad thing, right? But here's what I have heard, and tell me whether that's true, that if they have fillings in it, if they have had root canals, and all kinds of little things, all of a sudden those spots do not get bleached. And next thing you know is the guy looks like a leopard. Something, he just, it's like a zebra or something like that. Is that true?
Well, anything man-made is not going to bleach, So if you have white-colored fillings, tooth colored fillings, if they're matching fairly well now, after you bleach, they're probably not going to match, and that goes with any bleaching process. If you talk about a tooth that had a root canal done to it, and it was never restored with the crown, or the tooth itself won't bleach. So if you're going to take a natural tooth that had a root canal but it was discolored because of the infection, then we usually have to bleach it from either the inside of the tooth or put a crown on the tooth if we want to change the color. Bleaching from the outside probably won't change the color too much, so there are certain expectations that won't be met. But basically in general, anything man-made won't change color, so keep that in mind if you're going to bleach.
So you got to know that you might have a ceramic filling here and there. You might have forgotten about it. You don't realize, because after all, you guys do a good job to match it. It's not that when you smile, somebody sees you have a filling. You don't.
Right.
But you will see it after the bleaching. Now, how do you guys in the office take care of that?
Well, in our office, we'll warn the patient first, and if they decided they want to change the filling after they bleach, we can go ahead and do that for them, so we can match it to the new shade. And from that point, they just have to maintain the bleaching, so everything still matches okay.
So you do have the same problem. You just now use more tools to work around it.
Yeah, and we definitely want to make sure the patient's well informed, so they can make a decision based on all the facts.
Got it. Well, that's an awful lots of stuff about bleaching. Jesus, that's quite a process. Quite a lots of stuff you need to take care of. Thank you very much.